Good afternoon. I call to order this remote meeting of the House Commerce Committee and ask Mr. Dockendorf to take the roll.
Chair Stephenson.
Present.
Vice Chair Kotyza-Witthuhn.
Present.
Representative O'Driscoll.
O'Driscoll present.
Representative Barr.
Here.
Representative Carlson.
Carlson is present.
Representative Davney. Representative Davney, I think you just joined. Representative Elkins.
Elkins present.
Representative Haley.
Haley present, and Mr. Chair, just want to let you know I've been having IT issues with my Zoom camera, so I am here in the office, but they haven't been able to fix that feature yet today. So just wanted to make members aware.
Representative Kegel.
Present.
Representative Lee.
Lee present.
Representative Lilly.
Lilly present.
Representative Listlegard. Representative Lucero.
Lucero present.
Representative Olson.
Present.
Representative Farr.
Present.
Representative Rasmussen.
Rasmussen present.
Representative Richardson.
Present.
Representative Tice. And Representative Davney.
Present. Thank you.
Yep. And Representative Listlegard.
We have a quorum. Our first item of business is approving the minutes from March 1st of 2022. Vice Chair Kotyza-Witthuhn, do you have a motion?
Mr. Chair, I would move approval of the March 1st minutes.
Representative Kotyza-Witthuhn moves approval of the minutes from March 1st, 2022. Any discussion to that motion? Hearing none, all in favor say aye. Aye.
Aye.
Opposed? The motion prevails and the amendments are adopted for March 1st, 2022. The first bill on the calendar is my own, so I will hand the virtual gavel to Vice Chair Kotyza-Witthuhn.
Right. Members, first on the agenda, we have House File 3717. Chair Stephenson, would you like to move your bill before the committee?
Thank you, Madam Chair. I would move House File 2767 be laid over for possible inclusion. Did I get the bill number correct there? I think.
I said 3717, but you said 2767. Let's confirm which is which.
All right. 2767 it is.
Very good.
I will lay that over, move to lay that over for possible inclusion in the omnibus.
All right. Chair Stephenson moves that House File 2767 be laid over for possible inclusion in a liquor omnibus bill. There is an A1 amendment. Chair Stephenson, would you like to move the A1 amendment?
I would move the A1 amendment, which gets the bill in the shape I'd like the committee to consider it.
Very good. Members, any discussion to the A1 amendment to get the bill in the shape the author would like? Seeing none, all those in favor, please say aye.
Aye.
Aye. Any opposed? Motion prevails and the amendment is adopted. Chair Stephenson, to your bill as amended.
Thank you, Madam Chair, members of the committee. I'm going to speak very briefly because we have a large number of testifiers wishing to speak to this bill who I think many of whom have extensive and lengthy experience in the liquor industry. And so we'll be able to describe the bill in better detail than I possibly could. But I will just say that this bill establishes open wholesaling in Minnesota. This is a pro-competition and pro-consumer bill. It builds and expands upon the laws that we have had in place in Minnesota for many decades, known as the Coleman Act, but has it apply going forward to all liquor wholesalers, regardless of where they are based. I think that this is a system that has largely worked for Minnesota for many decades, and make sure that we will preserve a very competitive, robust liquor market that delivers good prices and good service for consumers and retailers in Minnesota. I think it's an important bill, and I'm pleased to bring it before the committee today. With that, Madam Chair, I think we can move to the testifiers, and then, of course, I'll be available for questions and more comments as we go along.
Thank you, Chair Stevenson. So first on the list, we have Michael Johnson with Johnson Brothers. Please introduce yourself for the record and proceed with your testimony.
Okay, good afternoon, Madam Chair and members of the committee. My name is Michael Johnson. I'm the chairman and co-owner of Johnson Brothers Liquor Company. We're a family-owned wine and spirits distributor based right here in St. Paul since 1953. Our company sells to every licensed bar, restaurant, and retail liquor store in the state of Minnesota. Our family has lived in St. Paul for over 100 years. My grandparents, my parents, my siblings and I, my 4 children were all born and raised in St. Paul, and our headquarters are just a few miles from the Capitol on Shepherd Road. Our company employs over 900 people across the state of Minnesota. We deliver to every city, to every town across the state, from International Falls to Worthington. The liquor laws that have been in effect in Minnesota for almost 50 years have worked extremely well for consumers and retailers alike. We've invested and built our business model based on this law and have strived to provide great customer service and selection to our retail partners. Competition is good for Minnesota consumers and retailers. We know that our customers have a choice of where to buy their spirits from, and that motivates us to work harder each and every day. This bill is critically important for our business and that of the other Minnesota-based spirit wholesalers, as well as our thousands of customers, which include bars, restaurants, and liquor stores. And of course, the individual customers across the state of Minnesota. Under the Spirits Open Wholesaling Law, Minnesota businesses and consumers enjoy vigorous competition, purchasing choice, quality service, and fair prices for distilled spirits. We're proud to be joined today by many other Minnesota-owned businesses in favor of House File 2767. Many are here today to share their reasons why they too support this bill and why they support healthy competition. Madam Chair and members of the committee, I want to thank you for allowing me to be here today, and I want to thank Chairman Stephenson for his sponsorship of this bill, and I ask for your support of House File 2767. Thank you.
Thank you, Mr. Johnson. Next, we have David Gewalb with Bellboy. Please introduce yourself for the record and proceed with your testimony. Mr. Gewalb, I'm not sure if you're on mute. We cannot hear you. All right, we will come back to you. Next on the list is Randy Trowbridge. Please introduce yourself and proceed with your testimony.
Thank you very much for allowing me to speak today. My name is Randy Trowbridge, and I am the manager of Fire Hall Municipal Liquors in Barnesville, Minnesota. If you're not sure where Barnesville is, we're about 25 miles southeast of Fargo-Moorhead. Most of our city's population actually works in the Fargo-Moorhead area, which means our goal is to get our residents to shop local. Thanks to open wholesaling, we can get the best prices without breaking our small store budget. As a small outstate liquor store, we don't have the buying power of the larger liquor stores. Open wholesaling allows us to get the best price and be competitive with those larger liquor stores. Especially in the past couple of years with the pandemic, with the supply chain issues and product shortages, being able to go to different vendors for our products, we've been able to keep products on our shelves and be profitable and keep our doors open. Open wholesaling in outstate Minnesota is a vital lifeline for the small liquor stores, bars, restaurants. It really makes it possible for us to be profitable in outstate small town Minnesota. If exclusive contracts are allowed, we won't be able to compete with the larger liquor stores. I mean, during the pandemic, we saw our orders being cut by wholesalers because our orders were smaller than the larger stores. If exclusive contracts are allowed, we're going to see this on a more regular basis. I just want to say that open wholesaling is vital and important in small town Minnesota. So thank you. Thank you for hearing this, and thank you for allowing me to speak.
Thank you, Ms. Trowbridge. Mr. Gewald, it looks like you are back. You can unmute yourself and introduce yourself and proceed with your testimony. Thank you.
Okay. Sorry about that.
No worries.
Madam Chairman, members of the committee, you can hear me now, correct? Okay, great. Madam Chairman and members of the committee, my name is David Gewald. I am owner and co-founder of Bellboy Corporation. Bellboy has been a Minnesota licensed distributor of liquor and wine since 1978. Bellboy is a Minnesota company located in Golden Valley and in St. Louis Park, Minnesota. We currently employ 65 people, consisting of 27 salespeople, 15 office employees, along with 16 warehouse workers and 8 truck drivers. Bellboy is a smaller distributor, but an important piece to the past 44 years. In August 1978, I personally took my propane forklift and unloaded our first truckload of nationally branded spirits. The Coleman Act had been recently enacted. I was the first to take advantage of the new open wholesale opportunity. At the time, I was not aware as to the impact Bellboy would have on the liquor distribution business in the state of Minnesota for the next 44 years. Up to 1978, the liquor distribution business in the state of Minnesota was controlled by a few distributors who had exclusive arrangements with the major suppliers. In essence, these distributors had a license to steal. They had a monopoly. They were free of any competition. Competition was a dirty word. Prices were very high prior to the Coleman Act and prior to my company entering the Minnesota market. The Coleman Act created an open system where monopolies disappeared. Immediately, prices on the shelves at all Minnesota retail stores dropped by $3 to $10 per bottle. Bellboy, through the support of Minnesota retail stores, Minnesota bars, and Minnesota restaurants, became a significant factor in the Minnesota market. We stood for honest and competitive and fair pricing. Bellboy created a healthy competitive market, which directly enhanced retail buying power, which in turn benefited the Minnesota consumer. Our current system has worked for 44 years. We have built our own business model based on the open wholesale system provided by the Coleman Act. Without open wholesaling, the Minnesota consumer will be forced to face higher prices on the shelves, as well as higher prices at Minnesota restaurants and Minnesota bars. I don't have to remind you that Minnesota restaurants and Minnesota bars cannot afford such dramatic increases. I have personally purchased, priced out, and sold liquor in Minnesota for 44 years. No one at this hearing today can say that. I've seen it all. We are all here today because certain non-Minnesota companies, one from Chicago, Illinois, and one from Miami, Florida, can no longer feel the pain of competition. Plain and simple, they yearn for the good old days. The 65 employees at Bellboy need your support on House File 2767. Do not make me look into their eyes of each employees at Bellboy and tell them that the state of Minnesota no longer allows me to support them and their families. For most families, it could not happen at a worse time. In addition, the liquor industry needs your support on House File 2767. Small business needs your support. Following me in testifying will be Minnesota retailers, Minnesota bars, and Minnesota restaurant owners. Listen to them clearly in their support of House File 2767. If the system ain't broken, there is no reason to try to fix it. Thank you all for your support today. Thank you.
Thank you, Mr. Gewald, for your testimony. Next, we have Kirsten Lewis. Please introduce yourself and proceed with your testimony.
Can you hear me? Okay.
Yes, we can.
All right, sounds good. My name's Kirsten Lewis. My parents have owned and operated franchisee of MGM Wine and Spirits for 17 years. I myself have worked for them for 14 years as the buyer and store manager. I also have a unique perspective in that I'm in my 13th year working behind the bar and alongside the owners of Wiederholtz, a supper club located in Meesville, Minnesota, who are fourth generation owners. Closing open wholesaling on liquor would have several profound effects on our industry, such as large price increases, availability, and the freedom to choose who we do business with. One thing about liquor is there's not a lot of choice when it comes to the everyday liquor items. I'm going to use one brand as an example, but so many more could be used as well. Captain Morgan is a very well-known spiced rum that is more than likely available in every liquor store and bar in Minnesota. Captain Morgan is also available from a minimum of 4 wholesalers. Having multiple wholesalers that carry Captain Morgan ensures that there is competition on its pricing. On another level, Captain Morgan has no real competitors on the shelf. Yes, there is knockoff brands of spiced rum and higher end spiced rums, but none that are synonymous with the brand Captain Morgan. Closing open wholesaling would mean that one wholesaler would have exclusive rights to sell Captain Morgan, which, coupled with the fact that there's no shelf competition, would give that wholesaler no ceiling on their pricing. There would be literally no competition for that product. Availability of product is another great area of concern for us. We all know that there is supply chain issues and a shortage of truck drivers and workers in general. The liquor industry has definitely not escaped this. When wholesalers don't have enough drivers and warehouse workers, deliveries get pushed further back and further back. One of my wholesalers had issues with this the entire summer, all the way to the Christmas holiday. There were some instances that I didn't receive my delivery for over 10 business days after it was supposed to have been delivered. Having open wholesaling allowed me to order items that were out of stock in my store from other wholesalers and get those products back on my shelf for consumers to buy. Continuing with open wholesaling also allows our business the freedom to do business with those wholesalers that also desire and work to see that our business thrives and does well. There are wholesalers that come into our store, take an order, and then leave. And then there are those motivated wholesalers that come in, stock, merchandise, build displays, and ask what they can do to help sell more product. That second kind of wholesaler is the kind of wholesaler I want and should be able to continue to buy our products from. When considering this bill, please take into account the small stores, the large stores, the bars and restaurants, and the everyday consumer who stands to lose the most if closing open wholesaling becomes reality. Thanks for your time, you guys.
Thank you, Ms. Lewis. Next up, Dean Rose and Eric Forsberg is on deck. Please introduce yourself and proceed with your testimony.
Thank you, Madam Vice Chair and House Commerce Committee members. My name is Dean Rose. I am a third-generation retailer of Broadway Liquor Outlet in Minneapolis. I grew up in the business from dusting shelves and sweeping floors as a kid growing up through the business to finally taking over the family operations in 1990. I want to express to you the importance of keeping the statute on open wholesaling in place for independent retailers and restaurateurs like myself. Currently, we have a statutory system that places restrictions on me as a retailer, so I can only buy from a handful of wholesalers in the state of Minnesota that sell intoxicating liquor. In fact, our statutes place strict and severe market restrictions on liquor retailers, including the right to negotiate volume discounts or join with other retailers to form collective buying groups. Yet for all the restrictions, the one bargain or benefit built into our system today that helps retailers is open wholesaling. Open wholesaling forces my suppliers to compete for my business. Since I operate in a very price-sensitive market, my margins are always under pressure to compete with other retailers. The current open wholesaling provision gives me the one benefit I need to compete on a level playing field against other retailers, especially the big box retailers like Target, Costco, or Total Wine and Spirits. My ability to have a free competitive market to purchase liquor from all suppliers is my only way to maintain my margins and survive as a family-owned independent retailer, which employs local residents and puts our profits back into the community. Now we have one of the largest wholesalers in the United States fighting against other wholesalers in our Minnesota market about a minor gotcha in the language of the Coleman Act, relating to distilled spirits manufactured in the state of Minnesota that represents actually less than 1% of our most retailers' sales revenue. The national brand products represent most of the sales of liquor in not only my store, but virtually all others. Eliminating open wholesaling will create a monopoly for certain wholesalers that will only cause prices to rise and access to products to be limited and contingent on other factors dictated by the wholesaler who has the franchise rights to a particular product. One group you won't hear from today is the liquor consumer, since most consumers are unaware of the intricate laws that we operate in as Minnesota liquor retailers to keep prices as competitive as possible. Ultimately, if open wholesaling is reversed, the consumer will pay higher prices for the same products that are currently available in our free competitive marketplace. You need to know that our current system works and is fair. It's a good, clean system. I strongly urge you to fix the language within the Coleman Act to keep open wholesaling as a status quo for all Minnesota liquor retailers. Thank you.
Thank you, Mr. Rose. Eric Forsberg is up and Paul Rupert is on deck. Please introduce yourself and proceed with your testimony.
Good afternoon. My name is Eric Forsberg. I am representing restaurants in downtown Minneapolis and surrounding suburbs. We have Devil's Advocate, Dan Kelly's Pub, Eric the Red, Acapulco's Restaurants, and Broadway Pizza Minneapolis. So my restaurants represent an interesting group that has experienced all of the fun that's happened over the last 2 years, and then some. When we're piling on something like this, I can tell you that the abolishment of Minnesota's open wholesaling for distilled spirits is just bad for Minnesota business. I'm sure it'd be great for Florida and Illinois business because that's where we'll be sending our checks. However, as I have proven in the past, I prefer to keep my money in the state where I conduct my business and with the people who support my business. As you've heard from some of the testimonies before us, like Mr. Jiwab's company, these are small companies that support our businesses, that give us the extra level of support that we need. And keep us in the margins that we can continue to thrive off of. The result of abolishing open wholesaling would obviously result in exclusive supplier relationships. I think what you heard about the Captain Morgan example is very real. You can use that example for many, many more brands. This is going to lead to massive inflation in our segment, and probably the most crucial area of our business. Now let's talk about where we've been, in timing with this. So the pandemic has obviously wreaked havoc on our industry. It's the worst disaster to have happened to us in history. Oftentimes when you're in the middle of things like this, there's a lot of sympathy and sentiment for our industry. And as it starts to come out of it, that starts to wane a little bit. The effects of what happened in this pandemic are going to be felt for decades. What many of you don't realize is that the average restaurant in Minnesota took on about $500,000 in debt just to stay open. Now, a lot of that money was spent for infrastructure in our spaces to help deal with pandemic. It went towards paying rent, it went towards paying utilities, and the rest is used to keep our staff employed. Now we're still facing massive inflation in every segment of our business, labor shortages that are unprecedented, equipment setbacks. We can't even build restaurants with the equipment that we want. Our food, we're having to buy from several different distributors because of the supply chain issues. Now, after years and years of fighting antiquated liquor laws in Minnesota, the one law that makes it to the floor is this. So all I can say is that you're hurting Minnesota business. You're going to continue to punish us at a time when we are being hurt more than ever. You're going to lose business. You're going to lose staff. You're going to lose customers. Everybody is going to feel that the negative effects of this should you abolish the current system that we have in place. There will be very clear winners and losers in this if you choose to take the route of abolishing the Coleman Act. I strongly encourage you to be in support of House File 2767 and make sure that we protect our Minnesota businesses, protect our Minnesota jobs, and help us build a new future together versus hurting us. Thank you for your time.
Thank you, Mr. Forsberg, for sharing your experience. Members, Paul Rupert was next on the list to testify. I'm not sure that he's in the Zoom room with us. Mr. Rupert, if you are, please unmute yourself. Otherwise, we will move on to Mark Jacob. Please introduce yourself and proceed with your testimony.
Hi, my name is Mark Jacob. I'm with the Ray Jays and Schulers Group. My brother Paul and I own and operate 3 bar and restaurants in the Twin Cities area. We've been in the bar industry our entire lives, with our father starting back in the 1960s. As many of you know, for us to survive this long, we need to be sure we're keeping tight margins and liquor costs to pass along to our customers. With the consistent rise in operational costs, this has become a challenge for everyone in our line of work. Removal of the Coleman Act will monopolize the market, unlike the food industry where we can buy and shop between 3 and 4 of our different sales buyers, US Foods, Cisco, and all that. It will not allow us to make sure our liquor distributors are keeping their prices competitive, which can cause certain liquors to rise in cost and price, like most people have been discussing. Make sure that we can keep our prices competitive with our customers. Our businesses have dealt with quite a few challenges the last 2 years since the start of the pandemic, and it's an additional unneeded change in an industry that has held no constants during this time. So we just want to please reconsider your decision on the removal of the Coleman Act.
Thank you, Mr. Jacob. And tiny testifiers are always welcome in commerce. Next on the list, we have Jennifer Schoenzeit. Please introduce yourself and proceed with your testimony.
Thank you very much for having us here today. I'm Jennifer Schoenzeit Scholler. I own Zips Liquor Store. My father started it. Now my brother and I run it here in Minneapolis. We've been here over 65 years. The thing that makes me the most nervous about losing open wholesaling is a lot of places now who are exclusive make you buy other products and package things together. And the advantage of having open wholesaling is you can choose what you want or choose to go somewhere else if you don't like what's being offered. It's lovely to have choices. This is great for big and small businesses across the state. As past president of the MLBA, I've traveled all over the state and seen all the small bars and liquor stores. And it's amazing the difference in all of us, but how we all have the same issues and fight the same fights. So I think that's so thank you very much for your time, and I hope you support the bill 2767.
Thank you, Mrs. Schoenzeit. Finally, we have Gary Bisey. Please introduce yourself and proceed with your testimony.
Hi, I'm Gary Bisey. I represent the city of Rogers, and I also represent over 200 municipal liquor stores throughout the state of Minnesota. I've been coming to the Capitol for our legislative day for a number of years, and I do appreciate the opportunity to speak to you today. One of the things that I've liked about going to the Capitol that I've seen the machinations of the background, which is happening today. And I was there when we discussed and eventually lost a very crucial piece of our freedom, I think, which was Sunday sales. And one of the most important things that was discussed on both sides of the aisle during that discussion, if you will, was the preservation of a free market. Because we understand that a free market is what is viable to any economic system. And every free market has to have certain impingements in order for it to function. And what you will do if you do not support this bill is you will completely decimate what is a working free market in the state of Minnesota. I'm hoping that that doesn't happen. Most of our business is through primary source, and that is we purchase that bottle of Captain Morgan from the company that gives us the best price for it. And please do remember that the 2 wholesalers that spoke to you earlier are also placing their businesses in the same competitive level that the other businesses that are not in support of this. And they're perfectly willing to compete against those businesses, unlike those other 2 businesses that are currently in opposition to 2767. Many of my peers in the business are forced to access liquor through secondary source based on a lack of ability to purchase that through out of stocks on primary source. This bill provides, as my predecessors have mentioned, consumer freedom, retailer freedom, and wholesaler freedom to operate competitively. And I guess I'd like to close with this. Imagine if you could only buy eggs in one place in the state of Minnesota. And your family likes eggs. So you go to that store and you find out that that store doesn't have any eggs. But you do know that the store down the street has eggs, but you aren't able to purchase those eggs because of legislation that restricts you from doing so. That's exactly what would happen to us in the retail industry if this bill does not pass, if this bill does not move forward, and we aren't preserved the freedom that we have right now to do the job that we do for our private businesses and for our municipalities throughout the state. This store contributes millions of dollars over the course of years to the city of Rogers, as our municipal liquor stores do. This would decimate those stores and place a lot of municipalities and their income sources and their enterprise funds in jeopardy. Thank you very much.
Thank you, Mr. Beisey. Chair Stephenson.
Thank you, Madam Chair. I just wanted to add a little bit to my earlier comments before we get to public testimony, because I want to make sure that everyone on the committee is sort of on the same page about the current state of things. So in Minnesota, we have the Coleman Act, which allows for open wholesaling for businesses based outside of Minnesota, but allows for exclusivity contracts for businesses based in Minnesota. That act is being challenged in court at the moment as unconstitutional. Whether that act is unconstitutional or not is not a question that's before this committee. What we are weighing is whether we want open wholesaling in Minnesota, which is what this bill does. In that litigation, there is a question of whether there should be uniformity across the board with exclusivity contracts allowed everywhere. One of the parties to litigation has made that suggestion, but that's not what this bill does. And so what we're talking about is not allowing exclusivity contracts in Minnesota, open wholesaling. And that's what I think the testifiers were all suggesting is the outcome that they would prefer. So with that clarification, I turn back over to the public.
Thank you, Mr. Chair. First on list for public testimony, Brad Redenius. Please introduce yourself and proceed with your testimony.
Good afternoon, and thank you, Madam Chair. My name is Brad Redenius, and I'm the Executive Vice President of Breakthrough Beverage here in Minnesota. We too employ hundreds of employees here in Minnesota throughout the state, and like Southern and Johnson and Bellboy, we call on all the retailers throughout the state of Minnesota. Breakthrough was founded in 1882 in St. Paul as Griggs Cooper and Company. We have been operating here as a liquor wholesaler, one of the oldest continually operating liquor wholesalers since 1956. And I can assure you and everyone else that we are just as much the home team as anybody else on the call. We oppose House File 2767 because it's not good for our industry. In fact, our own association is divided on that. I can assure you that we've had a lot of discussions about this, and we are neutral on this lawsuit, but we are opposed to changing the language in the current bill. In a letter that was circulated just a couple of weeks ago to the retailers, proponents of the legislation falsely state that without the bill, there'd be less competition, and I've heard a lot of that today as well. I can tell you that from my long experience working in the industry, both here and in other parts of the country, that statement is not true. All you need to do is look at the other 49 states around us that have fiercely competitive spirit markets, none of which have a law like the Coleman Act. Coleman Act is not what allows competition to thrive. Our company also distributes beer and wine here in addition to spirits, and there's no sound reason to mandate open wholesaling only for spirits while beer and wine benefit from the free market that they operate under, where manufacturers and wholesalers develop and organize relationships to best meet the own interest of the wholesalers and the retailers and the suppliers, along with the consumers. In Minnesota here, we have wine distributed by wholesalers on an exclusive arrangement that's made with wine suppliers, and beer is distributed through the wholesale network under the franchise law. Pricing all the brands of beer and wine remain very competitive here in Minnesota. They're not all priced higher under these exclusive or franchise arrangements. It's quite simply the result of the fact that pricing on products and brands whether it's fast food, dry cleaning, groceries, vehicles, furniture, you name it. Pricing on products are driven by the competition amongst the brands themselves. And in terms of beer, for example, Coors Light versus Bud Light. If whiskey, Jim Beam versus Jack Daniels. The point is, it's very normal and very healthy for brands to compete against other brands. The market is what drives the pricing on virtually any commodity or product. And the claims that exclusivity will suddenly cause prices in spirits to go up is really not factual. Proponents of the act and this bill also make another claim that without the Coleman Act, service from the wholesalers for the retailers will decline. In fact, the opposite is true. Brands compete against each other, as I said earlier, to win the consumer. They have many options, and we as wholesalers must service our retail accounts or our brands will not compete. So local and national chains compete against each other to attract the consumer, and in doing so, they drive prices down. It's not the unique Minnesota Coleman Act that accomplishes that. I strongly urge the members of this committee to not move on House File 2767, and I thank you for your time.
Thank you, Mr. Redenius.
Thank you.
Next on the list, we have Soren Sorensen. Please introduce yourself and proceed with your testimony.
Thank you, Madam Chair. My name is Soren Sorensen. I'm the Senior Vice President and General Manager of Southern Glazers Wine and Spirits of Minnesota. My company employs 217 Minnesotans who serve on and off sale retailers across the entire state. My company is also currently suing in federal court to strike down the so-called Coleman Act because it is unconstitutional. The Minnesota Department of Public Safety and the Attorney General's office agree. I understand it is a longstanding general practice for the legislature to avoid amending laws under judicial review. For that reason alone, I would highly encourage the committee to defeat House Bill 2767 with all due respect to the chairman. There are many other reasons to vote this bill down. The Coleman Act exists for one reason only, to give one wholesaler a significant and unfair advantage over other wholesalers in the same market. This bill, if it were passed, would do nothing to change that flaw. Furthermore, is the fact that the Minnesota Coleman Act is a complete anomaly in the landscape of liquor regulations throughout the country. None of the other 49 states have this law in their books, and there have been no efforts to pass similar legislation elsewhere. Ironically, the major wholesaler, which has benefited most from the Coleman Act and is advocating for this bill to allegedly fix the constitutionality problem, operates in 20 other states without a Coleman Act-like law. They do just fine without it. What does the Coleman Act do, and what would it continue to do even if this bill were to be enacted? It forces manufacturers to sell their products to every wholesaler. If I better represent a particular manufacturer's brand in the marketplace, why shouldn't the manufacturer be allowed to give only me its business? That's how the free market is supposed to work, and that's how it currently works for beer and wine. If House Bill 2767 were to be implemented, the Coleman Act would continue to needlessly interfere in the manufacturer-wholesaler relationship in a way that does not apply in any other consumer product. Again, an act that even doesn't apply to other forms of beverage alcohol, only spirits. In closing, members of the committee, I urge you not to move this bill. It specifically benefits only one wholesaler in our state about a law found only in Minnesota and would only impact spirits. The Coleman Act should only be revisited after the federal courts have spoken. The same markets that are free and open to the benefit of all beer and wine wholesalers in our state should be equally as free and open in all spirits wholesalers across Minnesota. I appreciate your time today. Thank you.
Thank you, Mr. Sorensen. Finally, Christy Brown, please introduce yourself and proceed with your testimony.
Thank you, Madam Chairman. Members of the committee, my name is Christy Brown. I'm Senior Director of Government Relations for DISCUS. It's the Distilled Spirits Council of the United States. We're the National Trade Association representing leading producers and marketers of distilled spirits sold in the United States. DISCUS members are referred to as the first tier in our country's three-tier system, and we supply products to wholesalers and retailers across the country. Laws regulating the alcohol industry do vary state by state, but because of the Coleman Act in Minnesota, Minnesota is completely unique. No other state in the union regulates the spirits industry the way this does. HF 2767 would continue making Minnesota an outlier as the only state that doesn't allow a manufacturer to choose their own wholesaler. Our members appreciate and value our relationships with the wholesale and retail tiers of our system. Allowing manufacturers and distributors to develop their own business relationships and contracts without state government dictating who and how businesses must interact with each other will create the best business environment for all involved, including the consumer. Even the federal government, in its recently published report on competition, acknowledged that laws that mandate which distributors a supplier must work with are bad for competition, and they encourage states to explore changes to these laws to bolster competition. Manufacturers need to protect and promote their brands as they see fit. This is a fundamental principle of business. They need to have the freedom to enter into distribution agreements which best advance their interests and the consumer's interests. The Coleman Act disrupts the free market and we believe will be found unconstitutional by the court. HF 2767 is not the solution. It would simply allow this anti-free market interference to continue. In summary, we ask that you look beyond this term, open wholesaling, which may sound reasonable, and consider the full story. HF 2767 would mandate spirits producers and manufacturers to enter into business agreements with all wholesalers, regardless of their business practices, reputation, or ability. We believe there is no public policy reason why the spirits industry should be treated differently than other manufacturers who are free to determine who distributes their products, including those in the wine and beer industries. Thank you for your consideration, and we ask the committee members to oppose HF 2767. Thanks.
Thank you, Ms. Brown. All right, members, we will move to discussion and questions. Representative Barr.
Thank you, Madam Chair. I had a couple of questions and I'm not well, I'm going to start with the author if we can start with that. I think you clarified this in your mid-testimony remarks, but we're only debating this bill. We're not actually debating open wholesaling and we're not actually debating the court or anything else. Is that correct?
Chair Stephenson.
Thank you, Madam Chair, Representative Barr. And yeah, I did try to clarify this and I'm not sure I did a great job, so I appreciate the question. So the bill would ensure that we have open wholesaling in Minnesota. Under current law, there's a law that heard referenced several times called the Coleman Act. And Coleman Act allows businesses that are based in Minnesota to enter into exclusive contracts, but does not allow businesses outside Minnesota to engage in exclusive contracts. As you heard, that law is subject to a court case right now about whether it is unconstitutional due to the Commerce Clause. I don't think we need to talk about, we're really debating here today whether that law is constitutional or unconstitutional. The question, what the bill would do is say no exclusive contracts in liquor distribution in Minnesota. And it would be regardless of whether the business is located in Minnesota or outside of Minnesota. And that is what you heard a number of Minnesota businesses and Minnesota retailers say that they supported during the testimonies. They would like no exclusive contracts, also known as open wholesaling in Minnesota.
Representative Barr.
Thank you, Madam Chair. Thank you for the clarification, Representative Stephenson, or Chair Stephenson, sorry. So
you can call me Zach, that's fine.
Well, probably not in committee anyway.
Yeah.
So with that note, what this bill does is actually for only distilled spirits, levels the playing field and says everyone must use the open wholesaling system, as opposed to actually making spirit manufacturers across the board actually compete for stuff, actually compete for their customers. It puts them all on a level playing field and saying, everybody will carry your product whether we want to or not, and the manufacturer doesn't actually have to go and create a public demand for this. The wholesalers will have access to everything whether you want to carry it or not. So I guess that's not really a question, more of a statement. I guess the statement would be, I think this is leveling the playing field the wrong direction. It should be opening the market for anybody or exclusivity. I know that the Coleman Act is only in 50 states, or we're the only one out of the 50. And the other 49, I go to Wisconsin pretty regular, and I've never had a problem buying a bottle of Patron over there. So I'm kind of not really getting where all of the testimony that was about this is going to destroy competition. I think that the Coleman Act is actually what prevents competition. I've never noticed a difference in price between Minnesota liquor and Wisconsin liquor. I have noticed some differences, like I can't buy Spotted Cow over here. And you do go to jail if you happen to go across the river, buy a keg of Spotted Cow and bring it back to Maple Grove and try and sell it in your bar. So maybe opening up some more wholesale distributing so we can get cross-border, or some of these regionals, some of the local, the micros would be maybe something we should look at and something that we should consider in the future. I don't know if there's really a question in there, but I had to comment on it anyway.
Chair Stephenson.
Well, I appreciate the comment, Representative Barr. I'm not sure I quite agree with your assessment of what the bill does in terms of forcing people to do things. But I think that that the system that we've heard here is actually a pro-competitive system, because I think that those exclusive contracts in the liquor system stymie people from entering the market and from competing on fair grounds. I'm not sure that it does quite what you said, but maybe we just view the market a little differently, and that's probably not the first time you and I have viewed the market a little differently. So that's okay, but I think that what you're hearing from people in the marketplace is that this will be pro-competitive and will help keep prices down. You heard from a number of testifiers who are experienced in the industry saying that. And I certainly don't want you to end up in jail over the keg of Spotted Cow. So I would encourage you to not do it in Hennepin County, where I'm a prosecutor, if you're going to end up doing that.
Thank you, Mr. Chair. Members, any further discussion? Representative Rasmussen.
Thank you, Madam Chair. I just had a question. I don't know who to direct this to, but was wondering, is there any other product category or industry in Minnesota law where we prohibit exclusive wholesaling or distributor contracts? Just a technical question.
Chair Stephenson.
Thank you, Madam Chair, Representative Rasmussen. I honestly don't know the answer to your question. It's a sort of exhaustive survey the landscape question. What I would say, though, is even assuming that sort of the premise perhaps of the question is correct, that it is the only one, that it maybe perhaps makes sense. We treat liquor very differently and for very good reason than any other subject, any other matter. And I think you can look not too far in the distant past to see why. And I think you heard some testimony about how this business used to be even before the 1970s. And of course, if you go further back into the era pre-prohibition, you can see other problems with the lack of competition in this industry. So there's, I think, good policy reasons to treat this product differently than others, but I couldn't tell you for sure that we are even treating it differently than others.
Chair or Representative Rasmussen, follow up.
Thank you, Madam Chair. No, I appreciate Chair Stevenson's comments.
Representative Farr.
Thank you, Madam Chair. So, Chair Stevens, just one question: if we have a system in the beer and wine and it's working there, why two different systems for spirits versus beer and wine? It just makes sense to me that we would have one system in play for alcohol in general.
Chair Stephenson.
Well, I think there's a really good policy reason to treat liquor differently than beer and wine with regard to exclusive contracts. And that is very simple. Beer goes bad. So when under Minnesota law, a distributor has an obligation to replace product if it expires or spoils or otherwise goes sour. And so you will find that beer wholesalers visit their retailers on a regular basis to switch out kegs and other products to take product that is no longer good off the shelves. That's because beer, doesn't last a really long time. You compare that to vodka or other distilled spirits, you just don't have the same issue. So why is that a significant difference? Well, a wholesaler is going to be really reluctant to swap out a keg of beer if they don't know that they're the ones who sold the keg of beer to the retailer. right? So having that exclusive relationship ensures safety for the consumers in a way that isn't necessary in the liquor space. So we can have the more competitive approach in the liquor space because we don't have the same safety concerns that require the exclusive relationship.
Representative Farr.
Yeah, I would just add that wine gets better with time, Mr. Chair. So
depends on the wine.
Touche. Okay, no, I'm good, thanks.
Can I add in on that? On the beer and wine, is there a chance that I can say something about that? Or is that not a thing? Sorry.
Typically, when we are in member comments and questions, there is no further.
Okay, all right. Sorry, I've never done this before. Okay.
Not a problem. Thank you. As members seeing no further member discussion, I'll move to Chair Stephenson for final comments.
Thank you, Madam Chair, members of the committee, for this pretty animated conversation. This isn't the last time we'll be talking about the Coleman Act as we're laying the bill over, and I do intend to bring this bill back as part of a liquor omnibus later, so we'll have more opportunities to discuss whether Representative Barr deserves to be in jail or not, but I appreciate the conversation and renew my motion.
Representative Stephenson renews his motion that House File 2767 is laid over for possible inclusion in a future omnibus bill. The bill is laid over, and I will return the gavel back to Chair Stephenson.
Thank you, Vice Chair Kotyza-Witthuhn. And just in time, because the next bill on the agenda is your bill, House File 1936. Representative Kotyza-Witthuhn, would you like to move your bill?
Thank you, Mr. Chair. I would move that House File 1936 be recommended to be placed on the General Register.
Representative Kotyza-Witthuhn moves House File 1936 be recommended to be placed on the General Register. Representative Kotyza-Witthuhn, to your bill.
Thank you, Mr. Chair. Members, just yesterday in our conversation about reinsurance, we discussed how important it is to be able to keep your doctor if you want to keep your doctor. House File 1936 helps to address this issue. It's really about three things: patient continuity of care, transparency in contracting, and the ability of a provider to plan their business. As we all know, it can be challenging to find a care provider or a specialist that's in your geographic area, has scheduling availability, and that you click with. Patients should have a reasonable expectation of consistency in that access to care. So the decision to terminate a contract with a provider has serious consequences on this patient access to care. Providers should also have some reasonable expectation of transparency and be able to know what the cause of a possible termination is so that they can either appeal that termination or have an understanding, at least, of what business practices need to be corrected. In conversations with health plans, I've learned that these conversations do sometimes occur, but they're not required right now. And this bill will ensure that all providers have the information necessary in order to move forward. Terminations without cause dramatically disrupt their business plan, shrink the group of customers that are accessible to them, and it also directly impacts their ability to operate in any given market. So, Mr. Chair, I know we have a number of testifiers to speak today, so we can move to public comment, and I'd be happy to stand for questions after the fact.
Thank you, Representative Kotyza-Witthuhn. We do have a number of testifiers. The first is Mr. Doug Broman from the Minnesota Chiropractic Association. Mr. Broman.
Good afternoon, Mr. Chair, members of the committee. My name is Dr. Doug Broman. I'm a legislative chair and member of the Insurance Committee and past president of the Minnesota Chiropractic Association, and I'm a practicing doctor of chiropractic. I practice in Maple Grove, and I've been in practice for 35 years. I practice with my son, also another doctor, and 2 massage therapists. On behalf of our organization, I want to thank you for providing me the opportunity to testify on House File 1936. As Representative Kotyza-Witthuhn, not sure I pronounced that correctly, mentioned, this bill is really about 3 things. It's about continuing care, transparency, and business planning. First and foremost, this bill protects patients from disruption in their treatment. When a consumer elects coverage under a health plan, they're presented with a network provider, and they can access under their plan. From that network, they select a provider that fits their unique needs, and in consultation, that provider, they begin a treatment plan. And as was mentioned, it's often about chemistry and finding a doctor that you are congruent with. At any rate, any decision made by the health plan to terminate a contract or remove a provider from a network undermines this doctor-patient relationship, which oftentimes lasts for several years. Recently, a network in Minnesota informed many practitioners that they would be terminated without cause at the end of 2021. These doctors had just over 3 months of notice to prepare and plan for a revenue decrease. And for many practitioners in this state, this could equate to a 20 to 30% or more drop in their annual revenue, ultimately affecting their ability to conduct business or retain staff. Our estimation is that at least 100 providers were impacted by this decision. More importantly, this caused many patients to lose their provider who they may have had for a long-term relationship. This decision and similar decisions made by health plans directly impacts patient access to care and forces them with the decision to pay out of pocket for necessary services or to seek a new provider. Because these decisions are sometimes made without cause, a provider has no means by which to protest. As a member of the insurance committee of the Minnesota Chiropractic Association, when the cut was made to the network last fall, we inquired as to the cause of termination. We were given only minimal insight about the decision-making process, and under current law, they have no responsibility to provide any further explanation. House File 1936 requires that an appeal process be made available to the provider, bringing greater transparency to the provider contracting process. Lastly, House File 1936 enables providers to plan for their business. In the case of chiropractic, most doctors operate in small private practices. They enroll in a health plan network and plan their business year accordingly on the conditions of those contracts. A termination of a contract without cause, regardless of the size of the contract, is a major disruption to a small business. In a time where small businesses and specifically healthcare providers are already facing many challenges and uncertainties, House File 1936 would grant them some assurance that entering into a contract with a health plan would be secure. Mr. Chair and members of the committee, I urge you to support this bill and help bring transparency and fairness to the health plan contracting. Thank you for your time.
Thank you, Dr. Broman. Sorry, I gave you the wrong honorific when I called on you before. The next testifier is Dr. Randy Kempfer from the Optometric Association.
Thank you.
Dr. Kempfer.
Thank you, Mr. Chairman. Hello, I am Dr. Randy Kempfer. I am an optometrist practicing in Fergus Falls, Minnesota at Envision Eye Care, where I am a partner in a 4-doctor private practice. I also am the president of the Minnesota Optometric Association, representing nearly 1,100 licensed optometrists in Minnesota. Optometrists are found in nearly every county of Minnesota. Some own their own clinics. Others are employed in group, multidisciplinary settings, in teaching institutions, and others in retail locations. I would like to thank Representative Kotyza-Witthuhn for bringing this bill forward and Chairman Stephenson for having this hearing today. The Minnesota Optometric Association is here today to support House File 1936. This bill is about transparency and fairness in provider contracts issued by insurance companies and access to care. As most patients rely only on receiving health care from in-network providers, being removed from an insurance panel suddenly can mean significant extra costs to patients to see the provider they know and trust. This can also have devastating consequences for a healthcare facility. As healthcare providers, if we are suddenly dropped from an insurance panel, we will have a group of patients that may no longer have access to the provider they rely on. This will disrupt continuity of care. A healthcare provider should also have the right to know why they are being terminated from an insurance panel, and a proper structure should be in place for that provider to provide feedback on why that termination is unjust. This bill would create a fair system for providers to understand the reasons and access to a fair appeal. Healthcare providers would also no longer have to worry that an insurance company would terminate their contract without cause, allowing us to focus more on providing the exceptional level of care Minnesota providers are known for. Thank you again for the time today, and I urge you to support House File 1936.
Thank you, Dr. Kempfer. The next testifier is Melissa Larson from Minnesota Medical Group Managers. Ms. Larson.
Thank you, Mr. Chair and committee. My name is Melissa Larson. I am the Vice President of the Minnesota Medical Group Managers Association, the MMGMA, and I am the President and CEO of Integrity Health Network. We're an independent practice association whose members are comprised of physician-owned clinics in outstate Minnesota. For those of you not familiar with an independent practice association, we negotiate contracts on behalf of our members, and we hold health plan contracts at a network level, and our member clinics can access those agreements. The MMGMA supports legislation to eliminate a health plan's ability to terminate a provider's contract without cause, as my network clinics did experience. 4 years ago, a health plan terminated its network level contract with my organization without cause, which led to 18 clinics losing access to their contract simply because the health plan no longer wished to negotiate in this manner. My organization had held this particular contract for nearly 8 years, but we had a contractual relationship with the payer that stemmed back nearly 20 years. Terminating this contract would have restricted patient access to primary care and specialty providers, while jeopardizing longstanding patient-physician relationships, as well as disrupting treatment protocols that were underway for acute or chronic conditions. The contract termination was not limited to just commercial products, but the plan's Medicare and Medicaid patients would have been impacted as well. Losing a health plan contract can be catastrophic to a small physician practice. I cannot stress this enough. This was an extremely chaotic time for patients, physicians and clinicians, clinic administrators, local employers, and even some small rural communities themselves, whose citizens risked losing access and continuation of medical care if their local clinic went out of business. Each of my network's 18 clinics deployed considerable financial and staff resources to obtain direct contracts so their patients' access to care was not disrupted. What quality of care or patient satisfaction was improved here? Absolutely none. As independent clinics, we do look to the state to protect our ability to continue providing service to our communities. We need to be here for our patients. Going through this experience just shows the need for legislation to eliminate a health plan's ability to terminate a contract without cause, which in my opinion can be classified as an abuse of power. This legislation will protect independent clinics from ever experiencing this in the future. Thank you, Mr. Chair and committee, for your time today. Please feel free to reach out to the MMGMA or myself if you have any further questions.
Thank you, Ms. Larson. And then our last testifier is a familiar face, Dan Andreessen from the Council of Health Plans. Mr. Andreessen.
Thank you, Mr. Chair, members of the committee. My name is Dan Andreessen with the Minnesota Council of Health Plans, the trade association for the nonprofit insurers here in the state, which include Blue Cross Blue Shield of Minnesota, Health Partners, Medica, Sanford Health Plan, and UCare. We appreciate the conversation we've had so far with Representative Kotyza-Witthuhn on this bill, and certainly want to keep having these discussions. So far, what we've been hearing when we've been talking to proponents of the bill, it sounds like this may be an issue in the self-insured market. So just want to make sure we're clear that this bill will only apply to the fully insured market. It won't apply to employer plans, Medicare. Not too sure how Medicaid falls into this, but I'll speak to how this impacts our plans here in the fully insured market. So like was said, plans and providers enter into contracts for healthcare services. Providers agree to provide care and follow certain standards. And then in return, the plan agrees to pay those providers at a given rate. Now, sometimes, just like any two entities that enter into a contract, there may be disagreements. And often when this happens, our plans try to work with providers to figure out what are those issues and how we can find solutions. Because in the end of the day, we don't want to terminate contracts with providers. We know that this impacts care, but we also have strict network adequacy requirements that we have to follow, ensuring that we're contracting with providers throughout the state. Additionally, there is a process in place through the Department of Health that allows providers to reach out with concerns, and the agency will step in and try to work out and try to find a solution between the two parties. But unfortunately, there are situations where differences can't be resolved and the contract can be terminated. This typically happens for a good reason. It can be an issue such as fraudulent billing, or it could be inappropriate use of care. And a good example is what we've seen over the past years with the opioid epidemic, where as we were tracking more and more prescriptions for opioids, sometimes we would see a provider maybe prescribing more than they need to, and so they'd reach out and try to work with that provider to figure out what's going on. But sometimes the provider would come back and say, I'm not going to change my ways, and so there was really no reason, there was no option but to terminate that contract. And so we would say that there is a process in place to handle these disputes, and don't feel like this proposal is necessary. But the language in the bill is going to cause some additional issues. It is going to create a new administrative burden for health plans in the fully insured market to create this process and have it go through the Commerce Department for approval. The language in the bill also prohibits plans from terminating a contract without clause, but doesn't apply that same standard to providers. So currently, providers can terminate a contract without clause at any time with a payer. And we have seen that in the past where a provider has terminated a contract in order to renegotiate and seek a higher reimbursement. So we feel that this will result in an uneven playing field between the two parties' negotiations. We're also unsure on how we would involve an external party in these disputes and still maintain confidentiality and legal protections for all parties. Payers don't disclose publicly why a provider is terminated from a contract, and I assume providers would not want that to change. So because of these reasons, the council will need to be opposed to the bill at this time, but happy to keep working, talking to the author and proponents on this issue. Thanks.
Thank you, Mr. Andreessen. There's no further public testimony, so we will move to member discussion and questions. Representative Rasmussen.
Thank you, Mr. Chair. My question is perhaps for the bill author or any of the researchers on, in the bill, it says that a health plan, cannot terminate a contract with a provider without cause. Is there any definition of cause, or I'm trying to figure out what would fall in or fall out of that? And in particular, especially after listening to Mr. Andreessen, it doesn't sound like plans are just doing this for the sake of doing it. They have to have some reason that they're deciding to do this. So I was wondering if anyone could answer that question or clarify it for me.
Well, I think without cause is a pretty defined legal term, well-developed in case law. But Representative Kotyza-Witthuhn, I don't know if you have additional comments about that, or we can also turn to House research.
Thank you, Mr. Chair, and thank you for that question, Representative Rasmussen. I agree with you. It seems to be that health plans do have some sort of reason for terminating a provider, but right now they're not required to disclose whatever that reason is to the provider, and there's no appeal process in place for them to kind of get additional information. So that's what this is trying to address.
And Representative Rasmussen, did you want to also direct that to, I don't know if you were satisfied by the answers that I and Representative Kotyza-Witthuhn gave, but we can certainly ask House research if you want.
Thank you, Mr. Chair. No, that's sufficient. I appreciate that. And I guess I just have a concern with, we oftentimes wonder why the costs of health insurance can be so high. And I think it's very clear that a bill like this just kind of creates more administrative burdens and costs that are going to ultimately show up in the premiums that Minnesotans pay in the fully insured market. And ultimately, one of the tools that health plans have is to create their networks to help manage costs and patient care on behalf of their members. And so I just worry that a bill like this just kind of is going to be adding additional costs to the system that we oftentimes on a bipartisan basis complain about, all of the wasted costs in administration and healthcare. And I worry that this bill Mr. Chair, is going to make that issue even worse. But thank you for answering my question, Representative Kotyza-Witthuhn, and for the discussion today.
Thank you, Representative Rasmussen. I see no members seeking recognition. So Representative Kotyza-Witthuhn, any final comments?
Thank you, Mr. Chair. Members, at the heart, this bill is seeking to protect patients and their continuity of care, as well as our healthcare providers who have been through so much over the last few years here. And I think it's a good bill. I'd appreciate your support.
Representative Kotyza-Witthuhn renews her motion that House File 1936 be recommended to be re-referred to the Health, Finance, and Policy Committee, and Mr. Dockendorf will take the roll.
Chair Stephenson.
Aye.
Stephenson, aye. Vice Chair Kotyza-Witthuhn.
Aye.
Kotyza-Witthuhn, aye. Representative O'Driscoll.
O'Driscoll, no.
O'Driscoll, no. Representative Barr. Representative Barr. Representative Carlson.
Carlson, aye.
Carlson, aye. Representative Davney.
Dabney, aye.
Dabney, aye. Representative Elkins.
Elkins, aye.
Elkins, aye. Representative Haley.
Haley, no.
Haley, no. Representative Cagle is excused for the rest of the afternoon. Representative Lee.
Lee, aye.
Lee, aye. Representative Listlegard.
Aye.
Listlegard, aye. Representative Lucero.
Lucero, no.
Lucero, no. Representative Olson.
Aye.
Olson, aye. Representative Farr.
No.
Farr, no. Representative Rasmussen.
Rasmussen, no.
Rasmussen, no. Representative Richardson.
Richardson, aye.
Richardson, aye. Representative Tice.
Tice, no.
Tice, no. And Representative Barr.
Barr, no.
Barr, no.
And Lily is aye.
I think you skipped Lily.
Oh, excuse me. Representative Lilly, aye. Thank you.
There being 10 ayes and 7 nays, the motion prevails, and House File 1936 is recommended to be placed on the general register. Our last bill on the agenda is another bill from our very own Representative Kotyza-Witthuhn. It's House File 3571. We have 18 minutes left in committee today, members, and I do intend that there be a vote on this bill. So we'll try and be mindful of that time. Representative Kotyza-Witthuhn, would you like to move your bill?
Thank you, Mr. Chair. I would move House File 3571 be recommended to be referred to the Health, Finance, and Policy Committee.
Representative Kotyza-Witthuhn moves House File 3571 be recommended to be referred to Health, Finance, and Policy. Representative Kotyza-Witthuhn, to your bill.
Thank you, Mr. Chair. And members, we had a really spirited discussion on PFAS last week in committee. We do have some testifiers to join us today. This bill in particular seeks to ban the manufacture, sale, et cetera, of juvenile products, which can be anything from an infant or toddler mattress to a baby bouncer to a play floor mat, tummy time floor mat. All of those sorts of items. Babies spend a lot of time trying to put things in their mouth, exploring the world through eating things, and I think that it's really important that we take steps in Minnesota to not only protect our infants and our littlest Minnesotans, but also taxpayers, because we know when PFAS ends up in our system and it's going through the water filtration systems, the taxpayers end up paying to replace those systems, as Representative Wozlowick touched on last week. So I will allow the testifiers to speak and be happy to stand for questions after the fact.
Thank you, Representative Kotyza-Witthuhn. We do have a number of testifiers, the first of which is Deanna White from Clean Water Action Alliance. Ms. White.
Thank you. Good afternoon, Chair Stephenson and members of the committee. I did submit written testimony, so in the interest of the short amount of time left, I'll try to summarize the contents of my testimony. My name is Deanna White. I'm the State Director of Clean Water Action, and I serve as the Director of the Healthy Legacy Coalition, which is a health-based coalition focused on ensuring that consumer products, especially those for children, are made without the use of toxic chemicals. We're here today in support of House File 3571. You've heard before about the dangers of PFAS chemicals. They're a class of chemicals that are in need of immediate action based on their threat to human health and the widespread and costly pollution in our environment. And I would refer you to my written testimony for a number of scientific studies on the health impacts and environmental impacts of PFAS pollution. The bill before the committee today prohibits PFAS in juvenile products, items that children come in close contact with. Children should not be exposed to hazardous chemicals where they eat, sleep, and play. Yet product testing has found PFAS in a variety of products for infants and kids under 12 years of age. The products in which PFAS was detected include baby beds, car seats, and mattresses, among others. Children are more vulnerable to health impacts from chemicals because low levels of exposure can disrupt key stages of development. PFAS in particular is especially harmful to children. A review of 64 health studies found positive associations between childhood exposure to PFAS and asthma, high cholesterol, and reduced kidney function. It's not fair to expect already overburdened parents to have to conduct a research project for every product that they buy. Children deserve to be protected, and parents deserve to know that they can trust the products that they buy for their children are safe. Some manufacturers are making products without PFAS, but it can be difficult to know for sure, and there are not always affordable options available. While the market movement is welcome, we need strong policies like this bill to stop the widespread use of PFAS chemicals whose entire life cycle is hazardous to people and the environment. It's not enough to merely rely on market forces to ensure that our communities are protected. We must address PFAS in all parts of the supply chain. This ban will help ensure that all manufacturers and retailers are held to the same standard and that their employees and customers are protected. When PFAS-containing products are used and disposed of, PFAS can migrate out of these products into the environment, including groundwater and sewage sludge. As a result of the widespread use of PFAS, more and more communities are being forced to address contamination in their drinking water sources. The difficulty and expense in treating PFAS contamination is an unfair burden on taxpayers and water systems. We know that a growing number of Americans are drinking water contaminated with PFAS, and that's not an acceptable cost of doing business. The public has been warned for many years about the dangers of PFAS, and there's a number of studies that have been released over the years and show that recommend that PFAS should only be used for essential purposes given their known health and environmental hazards. Responsible companies have heeded this warning by ending their use of PFAS, but we must ensure that all companies do the right thing. And this bill is an important step in helping businesses clean up their supply chain and stop PFAS contamination. Although there has been limited action on PFAS from the EPA in recent months, states continue to lead the way on PFAS pollution prevention. Over 30 states across the country are taking action to permanently close the door on non-essential uses of PFAS in products. We are asking the state of Minnesota to heed the call of EPA Administrator Michael Regan when he stated, every level of government from local to state to tribal to federal will need to exercise increased and sustained leadership to truly make progress on PFAS. Minnesota has been a national leader on prohibiting other harmful chemicals, and we hope that you will continue that trend by supporting the PFAS prevention package and passing House File 3571 today. Thank you.
Thank you, Ms. White. The next testifier is Lori Ollinger. Ms. Ollinger.
Thank you, Chair Stephenson and committee members. My name is Lori Ollinger, and I'm with the North Star chapter of Sierra Club, and I'm testifying in support of HF House File 3571, and I also will trim down some of my comments. We are conducting an experiment, one that will impact our children and their children. For the last 80 years, we've been putting a chemical PFAS into the environment. In that relatively short period of time, it's traveled to every part of the planet. It's toxic at very low levels, and we don't know how to get rid of it. You've heard a lot about the serious health risks from exposure to PFAS, and infants and children are particularly vulnerable based on their size and the fact that they're in a period of high development. Let's see. When it comes to children's products, what are the benefits of using PFAS? They are for stain prevention and to prevent products from getting wet. And if parents knew the risk, I don't think that they would be happy with the trade-off. Some people say we need PFAS for things like medical devices, but we are putting PFAS in everyday items for very little benefit. That's why this bill is so important. People assume that products they are buying are safe, and this bill can help make sure that that's the case. In 2019, we passed a bill that would ban flame retardants in juvenile products. It takes effect this July. It should be equally important and doable to remove PFAS from kids' products too. I urge you to support this bill. Thank you for your time.
Thank you very much. Our next testifier is Scott Vadnais from the Professional Firefighters. Mr. Vadnais. I don't see him unmuting. I think I will move on to the next testifier, and we can maybe come back if we can locate him. Our last testifier is Tony Quillis from the Chamber. Mr. Quillis.
Mr. Chairman, members of the committee, my name is Tony Quillis, and I'm the Director of Environmental Policy at the Minnesota Chamber of Commerce. Thank you for the opportunity today to express my concerns with House File 3571. Mr. Chairman, as we talked about last week, when we talked about the bills with ski wax and cosmetics and cookware, there are over 4,000 chemicals in this class structure with over 6,000 uses of it. And because of the size of the class structure and the uses, this isn't a chemical you can regulate in a one-size-fits-all. There's been abundance of activity on the state and federal level, and EPA Administrator Reagan has even said this is a priority for his agency in 2022. Mr. Chairman, where there's alternatives, the industry is moving towards them. But where there's not alternatives, that all of them have not been tested or approved by the federal government. Mr. Chairman, in regards to House File 3571, some of the products listed between 1.1 and 1.17 of the bill have multiple components, and a mere presence of PFAS in any of these component parts or in any of the products could result in a regulatory and enforcement action. Finally, Mr. Chairman, third-party certification is going to face a significant challenge. If you look at all those products on 1.1 to 1.17, all the components that go with it, the component parts tested against 4,000 chemicals that are in this class structure, leads to a logistical nightmare, Mr. Chairman, and is going to complicate the chain of commerce. Thank you for the opportunity, Mr. Chairman, to express my concerns, and I'll stick around if there's any questions.
Thank you, Mr. Quillis. I don't know that Mr. Vadnais is on the Zoom any longer. I looked through the Zoom screen here, but I'm going to call his name one more time, just see if we see him. I do not see him. So we will move to member discussion and questions. Representative Listlegard.
Well, thank you, Mr. Chair. I totally agree that PFAS is an extremely dangerous product, and we need to address it. My question is to the testifier or to Tony Quillis. What is the solution if we are to eliminate this out of every product? What is the solution moving forward? Just to say we're going to eliminate it, if there's really, it's in that many products, we're just going to wipe everything off the shelf. I want to know, talk to me more, help me understand what the solution is, because I don't understand what the solution is.
Well, I'll put the question first to the bill author, and then if she wants to direct it to one of the testifiers or Mr. Quillis, we can do that. But Representative Kotyza-Witthuhn, did you want to address that first, or do you want to defer to Ms. White or Ms. Ollinger? Gosh, I don't know why I have a hard time with that name. I'm sorry.
Thank you, Mr. Chair, and thank you, Representative Listlegard, for the question. I think it's a very valid concern. There are a number of alternatives to PFAS ingredients that are already available on the marketplace, and I think that most manufacturers, as Mr. Quillis alluded to, actually, I mean, they're trying to move the market in that direction. This ultimately is trying to stem the tide of new PFAS from entering the environment, from entering into the bodies of our littlest Minnesotans. And so I think the market's already looking for alternatives. And I think that perhaps Mrs. White can further address the Representative Listlegard's question, but we're trying to just stem the tide so that no additional PFAS are entering into the environment.
Ms. White, if you have a brief answer to that, we have about 6 minutes left. So if you could keep it to a minute or less, that'd be helpful. But Ms. White.
Yes, as Representative Kotyza-Witthuhn said, we believe that this bill will continue to push the market in the direction of finding safer, better alternatives. And in many places, we believe that the addition of PFAS is not absolutely necessary. We don't believe that this will drive us to any kind of particular shortages for juvenile products. We believe that this will continue to push the market and ensure that there's no backsliding in the marketplace.
Representative Listlegard.
Well, thank you, Mr. Chair. You said you don't believe that it will have that effect. How are we reassured that it won't have the effect?
I will put that question back to Representative Kotyza-Witthuhn first.
Thank you, Mr. Chair.
A couple of members seeking recognition, so let's
yes,
quick
absolutely. Representative Listgard, you may have noticed in the bill that this doesn't apply to used juvenile products. So I know that you know that I have some very young children, and so I have with my fellow parents in my area, we kind of swap goods amongst ourselves, and so I think that for a number of things that are already have entered into the marketplace, have been pre-owned, are still safe for our children to use without having to, toss everything out. I want to toss the baby out with the bathwater, as they say. And so I think that for new products to enter onto the shelves and have PFAS-free options out there, I think is a really good step in the right direction. But that there is a huge used marketplace for parents to search from as well if there is any lack.
Thank you, Mr. Chair.
Thank you. Representative O'Driscoll.
Thank you, Mr. Chair. Couple of things for the bill author. I think this is the third PFAS bill we've had in the committee in the last maybe 2 to 2.5 weeks. I'm going to just make a couple of comments, and I have just 2 quick questions. Number one, I had asked previously in committee whether or not we were going to be getting some information as to what to do in these short time frames if we are going to be banning these products, and do we have places in which to be able to, for retailers and others, to dispose of these? And I didn't hear anything today, so that still remains a concern of mine, given the large volume of PFAS that would be coming in beginning as early as January 1st of 2024. That is a little less than 2 years, it's about 20 months or so, that 22 months that we would be having on this. Could the bill author explain why a date change wasn't sought on this to try to accommodate the previous inquiries or that I had made of the committee? And I do have one other follow-up question, Mr. Chair.
Representative Kotyza-Witthuhn.
Thank you, Mr. Chair, and thank you, Representative O'Driscoll. Yes, we believe that most businesses are planning far out into the future. So should this piece of legislation be passed, I mean, they'll be aware of the implementation date and can, begin to shift into some of the other ingredients or alternatives that are already out on the market, or make adjustments as needed. I am open to pushing out that date if we can find a date perhaps a little bit more agreeable for businesses to be able to plan.
And Mr. Chair, I think I will dispense in the interest of time with my last question, but I will make this final comment. I am hearing from a lot of folks that our supply chain issues that we're experiencing right now are going to be even worse yet. I would suspect that businesses are making purchases and decisions on products and trying to get them as quickly as they can and in advance notice as they can to get them on the shelves for consumers. I don't know that this bill necessarily, again, helps support the issues that we have and a timely and orderly exit of the market of these. So unfortunately today I have to be a no on this bill.
Thank you, Representative Driscoll. Representative Dabney.
Thank you, Mr. Chair. I'll attempt to be brief here. I'm shocked at the lack of confidence that members bipartisanly have in the Minnesota business community that's being demonstrated here. And let me illustrate that with a brief story of earlier in my legislative career. I carried legislation that involved railroad workers, the railroads, and the insurance industry. And the railroad workers had identified a gap in insurance coverage on the part of the industry that left workers at risk. And through an extensive number of months of negotiations, the railroad industry agreed. this was a problem and they were willing to close that gap in the interest of protecting their workers. Final moments of the conference committee, all the stakeholders around the table, and then then the railroad industry suddenly went, oh, but we can't do this by the effective date of later this year because there's no such insurance product for us to purchase. And as everybody went, oh, well, okay, I guess we're done here, I turned to the insurance industry and said, if we put out the effective date for a year, will the insurance companies create a product to meet this need? And they said, absolutely. And we closed the deal and passed the bill. But it's only because, and Ms. White from Clean Water Action touched on this, it's only because we put out the requirement that we then spark the creativity of, in this case, the insurance industry. If we put out the requirement that PFAS chemicals are no longer in children's products, I have full confidence that the American capitalist system will respond. Thank you, Mr. Chair.
Thank you, Representative Dabney. Closing comments from Representative Kotyza-Witthuhn.
Thank you, Mr. Chair, and I will also attempt to be brief. Members will remember that we did some really good work on toxic toys ban last year. This is similar. We want to make sure that the world is a safer place for our littlest Minnesotans, and that our lakes and water of the state of Minnesota is going to be cleaner for years to come. And if we can't take action on that together, I don't know what we're doing here. I appreciate the support.
Thank you, Representative Kotyza-Witthuhn. With that, we renew her motion that House File 3571 be recommended to be referred to the Health, Finance, and Policy Committee, and ask Mr. Dockendorf to take the roll.
Chair Stephenson.
Aye.
Stephenson, aye. Vice Chair Kotyza-Witthuhn.
Aye.
Kotyza-Witthuhn, aye. Representative O'Driscoll.
O'Driscoll, no.
O'Driscoll, no. Representative Barr.
No.
Barr, no. Representative Carlson.
Carlson, yes.
Carlson, aye. Representative Dabney.
Dabney, aye.
Dabney, aye. Representative Elkins.
Elkins, aye.
Elkins, aye. Representative Haley.
Haley, no.
Haley, no. Representative Cagle is excused. Representative Lee.
Lee, aye.
Lee, aye. Representative Lilly.
Say the same thing that you texted.
Yeah. Lily, aye.
Lilly, aye. Representative Listlegard.
Aye.
Listlegard, aye. Representative Lucero.
Lucero, no.
Lucero, no. Representative Olson.
Aye.
Olson, aye. Representative Farr.
Farr, no.
Farr, no. Representative Rasmussen.
Rasmussen, no.
Rasmussen, no. Representative Richardson.
Richardson, aye.
Richardson, aye. And Representative Tice.
Tice, no.
There being 10 ayes and 7 nays, the motion prevails, and the bill is recommended to be referred to the Health, Finance, and Policy Committee. With that, we've exhausted our agenda and the meeting is adjourned.